Have you ever thought about food as medicine? Well, if you've never thought about it that way, then I hope this video is going to blow your mind. At minimum, I hope it at least opens it. Because the concept here is like before we had all these medications, food was medicine. And there are foods that we can eat that will actually help our bodies to fight off inflammation and make our knees feel better. So I did compile a list of what we're going to be talking about today, and I put it down in golferkneepainnomore.com. So feel free to click that link, go to that website, and you can get some PDFs of the information that I'm going to be covering here. So first off, I'd like to start with the anatomy of the knee because we're going to talk about specifically knee pain. I'm going to use this plastic model to kind of show what normal looks like. So this is a knee. These are the bones, the femur and the tibia and the kneecap here in the middle. And basically what causes knee pain would be inflammation of tendons, ligaments, and the cartilage in the joint. So on the ends of all the bones, you've got this soft cushion. It's called the cartilage. It's basically the shock absorber in the knees or in any other joints. Also, you've got these other little shock absorbers called the meniscus. These are rubbery bumpers or cushions on both sides of the joint, and these sort of offload and protect the knee from impact as well. And then you've got the ligaments. The ligaments are basically the structures that are around the entire knee, as well as a couple of the ligaments that are inside the knee. And the ligaments are made to make sure that the bones don't go a direction that they shouldn't. So it keeps the knee joint from going too far this direction, or it keeps from too much rotation. And so if you're loading the knee, rotating too much, and those ligaments get aggravated, that creates inflammation, and the inflammation can lead to some pain in your knee. Tendons also, if they're being loaded too hard, the tendons can also become inflamed, and that inflammation is what causes pain. Another source of knee pain, especially in golfers, is arthritis or degeneration. And this is a condition that occurs when the cartilage, that cushion on the ends of the bones, when that starts to wear down. When that happens, the cartilage becomes rough, and then you get inflammation in the knee. That inflammation makes the joint respond in a strange way. It starts to form these bone spurs, or what they're called. They're sharp corners and finger-like projections. And so that can ultimately lead to deformity in the knee as well. Not just ligament and tendon load can cause inflammation and pain in the knee, but also degeneration and arthritis. So this is a small little model showing sort of a normal knee. The cartilage, the normal cartilage, is depicted as blue here, and everything's nice and smooth. The edges of the bones have no sharp corners or bone spurs, and this is essentially depiction of a normal knee. And then arthritis, this is a case of like severe arthritis. What we can see is along the edges, the bone gets very rough. Those are called bone spurs. You can see the cartilage starts to kind of erode out. It's red to indicate that there's inflammation here, and that's what a degenerative knee looks like. So those are the causes potentially of knee pain in golf. The bottom line, the take home with all of that, is inflammation is what causes the pain. Whether it's inflammation of the cartilage or the tendons or the ligaments, it's that inflammation that's causing your symptoms. And so if we can get rid of that inflammation, we're going to get rid of the pain. And there are medications that are out there that are anti-inflammatory type medications, but they can have harmful side effects. And so we like to avoid those things if you can. Ice can also be very helpful to keep swelling down and reduce inflammation. But did you know that food can also cause inflammation in your body? And so that's the flip side of this, is if you're eating foods that are actually creating inflammation in your body, then it can make inflammatory knee pain even worse. And so some of the main culprits in our food chain is going to be added sugars, which are found everywhere, and added sugars are noted to cause more inflammation in your body. And then things like processed food, high risk additives, preservatives. These are chemicals that are added to our food to make them like look better, or the texture is better, or they're more tasty. But in the end, they're chemicals and they don't belong in our bodies. And when we ingest these things, it can affect our body's ability to heal and do what it's supposed to do. Also, some meat. A lot of meats can be inflammatory, and it's mostly going to be processed meats. And that's things like bacon, sausage, hot dogs, pepperoni, deli meats. These are all meats that have had chemicals added to them to make them last longer, but that also can create inflammation in your body. Too much beef or pork can also create inflammation and should be avoided. Processed carbohydrates and sugars are everywhere, and those things are also going to cause an inflammatory response in your body. And so just for an example, that would be like white bread. bread, and that's bread that's made with enriched white flour. So enriched is another word for saying processed, and basically all the whole grains are taken out of the wheat, and what you're left with is a processed flour, and that can be an inflammatory issue. So regular white bread, white pasta, pastries, donuts, cookies, cake, sugary cereals, soda, sweetened drinks, all of that stuff is inflammatory. It's just not natural, and it's not necessarily healthy. Industrial seed oils have been implicated as an inflammatory food also, and that's going to be corn oil, soybean oil, sunflower oil, cottonseed oil, and even highly processed vegetable oils and canola oils can be a problem. And then of course, obviously fried foods. So French fries, fried chicken, chips, Doritos, potato chips, all of those are fried. That fried food also creates inflammation in your body. And then certain other fats like margarines, store-bought frosting can do it. Excess alcohol is something else that can create inflammation in your body, and it does that because it affects the inner lining of your gut and causes some damage there, and that creates inflammation. Processed snack foods, obviously things like crackers and cheese puffs and candy. These are all foods that have added chemicals, and anything processed basically is going to be an inflammatory generator. Other additives like MSG or artificial sweeteners are also culprits. They can cause a lot of inflammation, which will make inflammatory problems in your knee even worse. Another one is dairy, and that's not inflammatory for everybody, but certain people that may be sensitive to dairy or have lactose intolerance, then dairy can be a problem. But cultured dairy like yogurt or cottage cheese is actually good because that fermented dairy can actually help your gut bacteria, and that reduces inflammation. So it's actually the opposite. Most standard dairy can be inflammatory, but the cultured dairy is actually anti-inflammatory. And then gluten for some people can also be an inflammatory issue. Certain people are sensitive to wheat, barley, and rye. So for those specific people, then gluten needs to be avoided. And so basically what it comes down to is like most of the foods that are not processed, fresh fruits, vegetables, fresh meats, lean meats especially, those are actually good for you. They're healthy for you. If you've got a food item and you're reading the ingredients and it's nothing that you would have in your kitchen, then it's likely not something you necessarily want to put in your body, especially when you read some of these chemicals that you can't even pronounce. Like clearly that's not a good thing to be sticking into your system. So something to be very mindful of if you want to reduce the inflammation in your body, and that will help your inflammatory knee pain improve. So the flip side of that is, how about foods that are anti-inflammatory? So I'll give you a short list of some foods that actually help counter inflammation, and that would be fatty fish like salmon. Turmeric is a spice that's got great anti-inflammatory properties, and that should be taken with black pepper so that your body can absorb it better. Leafy greens like kale and spinach are great. Berries, olive oil, nuts, especially walnuts, very anti-inflammatory. And then green tea are just specific examples. There are definitely more, but those are kind of the basics. So let me go into a diet thing a little bit. There are a lot of different diets out there. There's fad diets, there's carnivore and Mediterranean, and then there's like keto, and a lot of different kinds of diets out there, and it can be extremely confusing as to what is good for you. And I feel like a lot of the diets, if you're doing it for a short-term goal, then a lot of the diets that cut out certain foods can be okay. But in general, my feeling is if you're limiting yourself and cutting certain foods out of your diet, then you're also limiting the amount of nourishment, nutrients that your body needs. Because the bottom line is, the more stuff that you can eat that's healthy, the more nutrients that you're going to put into your body that will help your body do what it needs to do. And so when you cut out a basic food group or a large food group or a large item, you're going to be missing out on all those nutrients that would otherwise be helping your body. So one of the diets that's sort of risen to the top as being one of the better kind of diets, an anti-inflammatory diet, would be the Mediterranean diet. And the Mediterranean, that would be like the countries around the Mediterranean, like Greece and Italy, and the kind of foods that they eat. And that's actually scientifically supported to reduce inflammation. It also improves heart health and improves longevity. So that's basically going to be more plant-based vegetables, fruits, legumes, which are going to be like your beans and your lentils and your chickpeas, whole grains, not processed grains, but whole grains, nuts and seeds. Healthy fats like extra virgin olive oil, avocados, and olives are also part of that diet. And then the proteins are going to be lean proteins or lean meats. Their proteins are mostly seafood, but there's some poultry in there, eggs, and fermented dairy. And it's okay to do the red meats, as long as it's, again, smaller portions, that's not necessarily part of the Mediterranean diet, but like things like lamb, definitely part of that diet. But lean red meats, as long as you're taking them in small portions, are going to be absolutely fine. So again, the bottom line is trying to avoid the chemicals, the additives that we put in our food in this country to make them look or smell better or taste better. Try and stay natural, organic if you can do that, but healthy fruits and vegetables. You want to get a variety of different food items that can provide different kind of nourishment to help your body in different ways. And so again, go to golferkneepainnomore.com. I put in a list of these things so you can sort of review that. It's a downloadable PDF, so you have that information for yourself. But it's always important to check with your doctor to see what kind of diet is right for you specifically. So the other part of the diet, the flip side that I talk to my patients all the time about in the office, is going to be the weight loss aspect as well. I've been focused on the nourishment that comes from these foods and reducing the inflammation, but weight is important for knee pain because obviously the knee is a weight-bearing joint, and the more weight you're putting on that knee, the more inflammation, the more strain, the more stress you're going to put on that knee. And so one of the issues in America, obviously, is we've got an overweight, we've got an obesity issue. A lot of times people don't even think about the fact that they're overweight anymore and don't see that as a potential problem for them. But it is an issue, especially when we're talking about knee pain. So it's not only about eating right, but it's about losing weight. So smaller portion sizes, making sure that you're getting your exercise to burn those calories and get the weight off those knees, and that's going to help with the pain in your knees as well. Again, the bottom line with this whole thing, inflammation is what causes the pain. So we want to avoid food that will create more inflammation in our body, and actually we want to ingest food that will take the inflammation away from your body. So there's a role for medications, but again, anti-inflammatory type medications can have potential really bad side effects, and so as a long-term solution, that should definitely be avoided. And my feeling is it's better to use food as medicine. So thanks for watching. I hope you found this informative. If you did, please like and subscribe. I'm Dr. Brad Homan, and I hope I'm encouraging you to stay healthy and pain-free in a more natural way. So just take care of your body, and it will take care of you.